Hello, everyone, and thank you for joining me for my presentation, Parenting Children with Down Syndrome During a Pandemic. This is the New Zealand experience. My name is Gretchen Good. I am from the School of Health Sciences at Massey University in New Zealand. I'm the mother of two children who live with Down syndrome. I have a professional background in teaching blind and vision impaired adults and children. And I'm currently involved in research related to disability and disasters, disability advocacy, disability access to national parks. These are my two children, Leo and Tiffany. Tiffany is 10 and Leo is 13. They both have Down syndrome, vision impairment, hearing impairment, and other health impairments. Our New Zealand experience was first and foremost, the message that we had was be kind. And I realized that our New Zealand COVID experience has been very different from what has happened in other parts of the world. I am presenting to you the experiences of the lockdowns of 2020 and 2021 from the perspective of a parent with disabled children. Not only were we supposed to be kind during our COVID experience, but we had another motto, and that was go hard, go early. So overnight, we had severe lockdowns with very short notice. And overnight, we lost carers and supporters that we rely on to help educate and care for our children. The New Zealand lockdown was strict, the strictest in the world, we are told. It was enforced. It was against the law to break the restrictions of lockdown, and it was taken very seriously. Lockdown was very brief, compared to world standards. And there was a unified feeling of camaraderie, which was a nice aspect of the lockdown for us. So our mottos were be kind, stay home, save lives. We had another motto. We called ourselves a team of 5 million because we worked together to try to take care of each other during our lockdowns. We had a few bright moments. Our Prime Minister, Jacinda Ardern, instigated the great teddy bear hunt and Easter egg hunts. And there is a picture of my children, Leo and Tiffany, pointing in a neighbor's window at a teddy bear in the window. So people put teddy bears in their windows, and out on our daily walks, our children looked for those teddy bears. And our Prime Minister declared that the Tooth Fairy and the Easter Bunny were essential workers and could do their jobs even though we were locked down in our homes. The lockdown levels in New Zealand had 4 levels in 2020, and these were some of the world's strictest. At level 1, it was the most minimum level of lockdown. Just be ready. Level 2, you can go to work and you can go to school, but you have to follow public health measures about washing hands, social distancing, and wearing masks. Level 3, work from home and learn from home. And level 4, stay at home and keep in your immediate household bubble. In level 4, our schools were closed, playgrounds were closed, childcare, therapies, all didn't happen. Church, sports, and other community activities were lost. Travel was severely limited. You were not supposed to get in your car and drive. All gatherings were canceled. All public venues were closed. All businesses were closed except for essential services, such as supermarkets, pharmacies, health clinics, petrol stations, and lifeline utilities. So there was no shopping at no McDonald's. There was no ordering coffees to take away. Businesses were closed. Our timeline of our lockdowns are that in February, the first cases of COVID were reported in New Zealand. In March, we went to level 2. On the 21st, 2 days later, we went into immediate level 3 with very short notice. That means no work or no school. And then 2 days later, we went into level 4. The whole country was locked down. In late April, children of essential workers could return to school. And in mid-May, we went to level 2 and all children could return to school. So our children were not able to go to school for 9 weeks. Here's a picture of my son, Leo, who has Down syndrome, hearing loss, and vision impairments, playing with letter tiles. This was in the local newspaper, and the headline was "Families of Children with Disabilities, a Hidden Minority During COVID-19 Lockdown, Many Still in Survival Mode." That was a newspaper article from October 14th, 2020, and it was about I was talking about what families were going through in New Zealand during our lockdown. So our experiences are that parents and disabled children had unique challenges, unique to what other families had. We were a hidden minority. The ministries of education, schools, employers, medical facilities, and the media ignored us. Recovery was a challenge, adjusting to the new normal. And we have things that we want professionals to know to help us better in future lockdowns. So all parents had to deal with the unpredictability of what was going to happen, the loss of control, the worry about the future, the lack of distraction, so much time at home to worry, big feelings, lots of stress. And how do you explain this to your children? But parents of disabled children had to deal with hearing, "Oh, we're all in the same boat," but we are not all in the same boat. We might all be in the same storm, but some of us are on yachts and some of us are in dinghies. Disabled children can regress and lose what has taken years to learn. Parents of disabled children can't possibly educate their children at home, supervise them full-time, and work. And so much support that families and children needed was lost during these lockdown periods. Here are Tiffany and Leo, and we have lots of stories to tell about our lockdown. Leo is a very diligent student. He loves to sit and work, but he did need a lot of support, and I needed to create his learning materials for him because the school did not provide any adapted learning materials for him. So every night I created learning materials in large print suitable for Leo's learning. Tiffany, there she is. I taught her how to use the telephone, and there's the telephone keyboard on the wall behind her. She is our little whirlwind. She's an escape artist, and she really experienced grief during our lockdowns. She missed playgrounds and school and church and did not understand why she couldn't see her friends or her teachers or her therapists. She struggled, had temper tantrums, and she needs to be supervised very closely. Tiffany has a seizure disorder also. So it was very difficult to keep her supervised and safe and happy during our lockdown. We are hearing from other parents around the world about their experiences. Mothers are suffering, bearing the load of homeschooling, doing therapies at home, doing all the communication with all the teachers and specialists and medical people, doing the housework, and often still trying to keep working. And women are leaving employment due to childcare responsibilities. We're still hearing about this now. There were learning pods that happened within neighborhoods where children would get together in groups and parents would employ a teacher, but they did not include disabled children. These were discriminatory learning pods, and it was very disheartening to hear about these things happening in neighborhoods. Staggered schedules for return to school, hybrid scheduling of distance and in face-to-face learning that did not meet the needs of disabled children. And our children would return to different classrooms, different teachers, new classmates, because they had to reconfigure things so siblings stayed together and social distancing. and the therapists weren't able to come into the schools. That was not working for disabled children. And really importantly, we are hearing that individualized education plans that have been so carefully prepared for children to ensure their fair education have been ignored. So IEP documents were ignored during lockdown and since then as well. Here's a quote from parents explaining how difficult it was to help a teenager with homeschooling. He can't type his password, can't click on his email, can't open Google Meet, can't click the join button, can't mute or unmute his microphone, can't join a breakout room, gets frustrated when he says no 20 or 30 times about the class's song choices, gestures at a screen in ways his teachers can't see, dances out of view of the camera so his teachers don't know he's participating. On and on the list of can'ts goes. And again, I'm crying. And even with the documentation that distance learning is failing, the school district doesn't seem to care. We want professionals to know that we were in survival mode during lockdowns, and we had to put the emotional well-being of our family before teaching our children at home and doing home therapies. But we also had to work, and sometimes we had to put our work responsibilities first to keep a roof over our family's head. Contact from service providers was not always helpful. I would get lots of phone calls from service providers like the Blind Foundation, but there was nothing they could offer us. They weren't allowed to leave their homes either. They couldn't bring us equipment, couldn't enlarge any materials for my children so they could see it, because they could not go into their offices or come to our home. So just phone calls from service providers just checking in wasn't always very helpful. We want professionals to know that relationships were strained under the stress. The schools gave us no support. Although other children got support and learning materials, nothing was adapted for our children. Therapies, extracurricular activities disappeared, and our children really mourned that. We had to create materials each night for the next day for our children's learning. And the online learning and the televised lessons that were so carefully put together for our children were not designed for our children who could not access it. And the materials sent to us by the Ministry of Education were completely inappropriate for our children, not adapted for our children's needs. So we've had lockdowns in 2021. Have any lessons been learned? Well, in August, all of New Zealand went back into level 4 lockdown when Delta made its way to New Zealand. And we were in lockdown for about 3 weeks. And outside of the big city of Auckland, children could return to school on September the 7th. But still, today in October, parts of New Zealand are still in lockdown, and many children are still not attending school, which is very challenging for the children and their families. But did we learn any lessons from 2020? We had better ways of managing lockdown in our household. We learned that a routine and a schedule was really important. We did school at home at 9:30 in the morning, arts and crafts at 2:30, gym and exercise, physical education at 3 o'clock outside, and we played board games in the evening. This routine really helped us. And although we had that wonderful routine, we still had to work. My husband and I still both had to work full time while supervising our children and educating them. So it was a challenge, but we had better ways of managing. We knew that the routine was important. We had accumulated the learning materials and had arts and crafts materials at home ready for another lockdown. There's a picture of Leo making sushi one afternoon, and there is Tiffany, who hasn't mastered wearing a mask, but her doll is wearing her mask. In 2021 lockdowns, the school responded to our needs much better. Appropriate learning materials were dropped off at our home. Learning devices for each child with the appropriate learning materials were brought to us. We got learning stories about wearing a mask and about what COVID is all about and about social distancing and why we have to stay home. This time, toys and games and crafts could be purchased online. We couldn't do that in 2020. But still, there was nothing from the Ministry of Education to support our children's learning at home, despite the fact we heard they had sensory learning packs to distribute to disabled children, but I don't know anybody who received one. Some distance education worked this time. In 2021, we had successful speech therapy sessions over Zoom, and our children each met with their classmates and teachers over Zoom, although the activities were not adapted. There were also some fun activities that worked. And the second time we had lockdown, where they didn't work the first time. I think everybody finally figured out how to make these things work, like dance parties and listening to storytellers online. Some reasonable accommodations were provided by the government in 2021. Our children got letters saying they were exempt from wearing masks, and we got a travel exemption letter that allowed our family to drive short distance to get to a local beach, so the children had a safe place to get some exercise and get some fresh air. This was a really wonderful exemption for our family. This time around, we are also getting a dose of hope: vaccines. Children aged 12 to 17 are now eligible for the vaccine. Sensory clinics are available for children and adults with special needs. There is now transportation being provided to vaccine clinics, and carers and teachers must all be vaccinated by January 1st. But we are still hearing that families in Auckland are still struggling. They're still in lockdown, and these quotes are from families in Auckland. They haven't gotten anything from the Ministry of Education. They have heard nothing, and nothing has been supplied. They're just ticking along, taking one day at a time. Our kids need better educational support than this, and the schools don't care. It's very disappointing and disheartening. Do we need more support? Yes. We have daily meltdowns, and the stories go on and on from families experiencing lockdown. There is some positives, though. This last quote is, "My son's school has been awesome. Learning packs sent out, and his class teacher checks in with us at least once a week. There are always additional activities, and this child goes to a special needs school, which probably makes a big difference." So what do we want in the future? We want vaccinations for younger children, ages 5 to 12, and we're hoping that's coming soon, so all school children can be safe. We want help for our children to learn how to wear their masks. That would keep them safer. We want adapted schoolwork regularly if we have lockdowns again. We want teacher aides who continued to get paid during lockdown, but they weren't available. It would be great if they could be assigned to families and help them, even if it's online, or helping to create learning materials for the children. We would like exemptions to have carers in our homes to help us support our children so we can continue with our jobs and help supporting our children and with homeschooling. Our children need some spiritual and church opportunities. That's available for adults online, but nothing has been made available for children in that line. Families need technological support during times of lockdown so that keep us all connected. Financial support is needed certainly for some families to keep food on the table during lockdowns. And we need mental health support for children and families. We have done it before in New Zealand, and we hope we can do it again, keep most of us safe from COVID, and we hope the whole world can be relieved of this disastrous COVID epidemic in the very near future. I would love to hear your stories of your family's experience of lockdown. And there is my email address. I would love to hear any stories you have to share. It's g.a.good@massey.ac.nz. Thank you.